All right, docs, let's work up a typical wrist or hand examination together here. Uh, there are several conditions that we can treat in clinical practice. Probably the most common one for our doctors in our group that you could maybe develop a niche out of would be carpal tunnel syndrome. So it's important you know how to work that up, but let's show you all the tests that you could do that will pretty much cover any conditions you're going to see in the wrist or hand. So when I start examination of wrist or hand, I usually always start with range of motion. So the four cardinal movements you would have the patient do, and I a lot of times will sit right in front of them and I'll just demonstrate the movement. So Noah, flex your wrist down, flex it up far as you can, back to neutral, and now inward and outward. So flexion, extension, or radial deviation, ulnar deviation, looking for limited motion or pain, okay? Obviously notate where the pain is at when you do your documentation. Then I would usually do the same motions, but I would just do them passively and looking for any pain or limitation in those four cardinal movements. Of course, you can take, if you have some finger involved, I would never probably do range of motion every finger, but if there was like, oh, this finger gives me trouble, doc, well, then I would check some of the active and passive motions of that. Mostly you'd be looking at flexion and extension. I always, when I'm doing range of motion with this, I'll just go right a lot of times into resisted type motion. So hold your wrist up, Noah, don't let me push it down. Let your wrist go down, keep it down, don't let me pull it up. Let your wrist come in, keep it there, don't let me pull it out, and let it go out, hold it there, don't let me push it back in. And of course you can do that with different fingers too, resisted flexion, resisted extension of any of the digits that you want to. So quickly you've screened through active motion, passive motion, and resisted muscle testing. Good test to do for things like sprain strain injuries or tendonitis around the wrist or tendonitis in the fingers. If you have a patient that has something like Raynaud's phenomenon or any circulatory issues, it's important to do Allen's test. And so that'll be the first orthopedic test we'll cover here. Now I'm going to have you raise your hand and I want you to pump your fist several times, okay? Now, hold your fist closed, keep it there, and we're going to bring your hand down. You want to include the ulnar and radial arteries. Now open your hand on, and now I'm releasing the radial artery. The redness should come back into the hand within 5 seconds or less. If it takes longer than 5 seconds, his came in almost instantly. But if it takes longer than 5 seconds, then you're thinking maybe there's something going on with the thoracic outlet, like claudication of the brachial, not the brachial plexus, but the arteries that run along with the brachial plexus. So vascular TOS. Pump it one more time, Noah. Then keep the fist tight, and then okay. Now open, and now I'm checking the ulnar, and they both fill. So if you see abnormality with that, then you would maybe want to do some of your TOS, thoracic outlet syndrome tests that we covered in the cervical examination. So you will find those there. A lot of people that have wrist pain, one of the first symptoms of rheumatoid arthritis is wrist or hand swelling and pain. So a simple test you can do to see, especially if you note some swelling, it's called bracelet test. You stabilize the hand, you grasp around it with the wrist around it, and you squeeze the radial and ulnar joint, so the distal radial ulnar joint together, or you can squeeze the carpals together as well. And if that produces pain, it sometimes is an indicator of rheumatoid arthritis. A lot of people that have osteoarthritis, you will see they get these Heberden's nodes and different nodules. And sometimes they'll have joints that they can't move very well. So a simple test that you can do to look for joint contracture is something called Bonnell-Littler test. And with that one, you would bring the finger into that's in question into full extension. So you push into it, and then you see if you can bring the finger, if it will bend over it, like that. And then you can bring it into the next joint and see if it will bend over that. And then the following one. If you can't, if you push into that and it's like, it doesn't move, or you push and it doesn't move, you have a joint contracture likely related to osteoarthritis. So simple test, you're just looking for joint capsular contraction there. A lot of people that have wrist pain will get pain right in here in the snuff box. And a lot of times that's tenosynovitis of the abductor pollicis longus or extensor pollicis brevis tendon. So a lot of times we'll do a test called Finkelstein's test. No, curl your thumb in, close your fingers over that, and then what we have them do is we just say, let your wrist relax and let me bend it. And we stabilize here, and we basically are bringing the wrist into ulnar deviation like this. And that's going to pull right through that area. If they have an active tendonitis or tenosynovitis of those tendons coming through there, it's a confirmatory test for that. Laser shockwave works great in that, and also you got to palpate these muscles coming up through the forearm to see if there's problems there. Let's talk about carpal tunnel tests. So the first one I do with some of my patients is called Phelan's test. So Noah, you're going to bend your wrists like this. You're going to put them back to back so they touch each other like that. And then bring your elbows so they're a little bit more. There you go. So you want those elbows not like this, but you want them like this. And then they're holding those wrists. This mimics, a lot of times you'll get the carpal tunnel patient that said, oh, when I go sleep at night, my hand goes numb. A lot of times it's because their wrist is curled in underneath them, or they're laying in such a way their wrist is cocked like that. And then they wake up and they gotta shake their hand up because it's fallen asleep. This reproduces that position. Sometimes the only bad part about this test is you gotta usually do it up to 60 seconds. And what you're looking for is a reproduction of that. Oh yeah, it's making my hand go numb, doc. It's in the distribution of the median nerve, okay? All right, you can also do one called reverse Phelan, or it's called prayer sign. So it's just like this, Noah, pushing together. Again, you don't want the arms like this, you want them like this. And that's another position you can have them hold for about 60 seconds to see, does it reproduce any of the hand symptoms that they're getting? And if it does, it's confirmatory for carpal tunnel syndrome. That's a good test. The other one I do, there's a couple more. A lot of times you can just palpate right into the carpals. Here are the wrist bones, and put direct pressure. So, of course, we know chiropractically the lunate bone in here is very important for carpal tunnel. So usually what I'll do is I'll just lightly palpate, and if I find anything that's a little restricted or tender, I'll just put direct, firm pressure right into that, and they'll like, ooh, that hurts. And what you'll do is hold it, and a lot of times they'll say, oh yeah, doc, there it is. I can feel it go down into my fingers, that familiar tingling or numbness that they get. So that is called carpal compression test, okay? The other one you would want to use is your classic Tinel's test. And that, you take a reflex hammer. I don't like those short little ones they give us in school. I like these longer ones that got a little whip to it, okay? And what you want to do with that is tap right over the carpal tunnel area. So I always tell patients, I'm going to tap over your carpal tunnel area, and the normal thing is you should feel the pressure in me tapping on there. Abnormal would be you feel it zing down into your fingers. So tap right over there several times, kind of work it around up and down a little bit through that area. If they have carpal tunnel more times than not, they'll say, oh yeah, it goes right down into that middle finger, doc, or the thumb, or any combination of those first 4 or all those fingers. And it's only positive if it goes distal to the site that you're tapping. That, of course, is the median nerve. There's also one other area in the hand and wrist you should do Tinels over, which is right on the medial border of the hand and wrist right here. There's a little tunnel there called the tunnel of Guyon, and that is where the ulnar nerve comes through. Of course, that goes to thumb, or the little finger and the ring finger. Sometimes that will get entrapped right there. So I will also do Tinels tap right over that area. Sometimes you actually hit a reflex there. And what you're looking for is a reproduction of symptoms into those two fingers. So carpal tunnel, tunnel of Guyon. Okay? Now, there's a dynamometer. I forgot to bring it over here. If you got a carpal tunnel patient, or any patient that has any weakness, because a lot of carpal tunnel patients, they drop things. So I always do a dynamometer test on them, looking for grip strength. So now hold this in your hand like that, like you're gripping it. So that come around, there you go. You're gonna have them straighten their elbow, cock the wrist out, and squeeze that baby as hard as you can. And then when you're done squeezing, hand it back to me. There we go. And we get about 88 pounds of grip strength. Usually what you want to do, best practice with this, is do 3 readings on the left, 3 readings on the right, and average them. Typically in the dominant hand, they should be about 5 to 10% stronger than in the non-dominant hand. A lot of times in carpal tunnel, you'll see they're weak, okay? Important to do that. The other test, sometimes you can get nerve entrapments of different branches of some of these nerves. So one other test I'll do is called pinch grip. So I want you to put your thumb and index finger, pulp the tip to tip together, okay? Somebody that has entrapment of the anterior interosseous branch of the median nerve, they can't hold it tip to tip. It's like this instead of like this. And the other thing you can do is test it. Don't let me pull your fingers apart. You shouldn't be able to pull that apart unless you really crank on it. But somebody that has entrapment of that nerve, you'll just pull right out of that, okay? So pinch grip test is important. Another one I do is, so that is anterior interosseous nerve pinch grip, or sometimes it can be a sign of weakness of the ulnar nerve. The other one I'll do is called Froment's paper sign. So now I'm gonna have you squeeze this piece of paper between your fingers, okay? Keep it, I'm gonna try to pull away, but you're not gonna let me. That's what this should happen, okay? You can let it go. If they have weakness of the ulnar nerve or entrapment of the anterior interosseous nerve, a lot of times they can't hold that paper together. So that would be a positive test. Finally, Noah, put your thumb and little finger together. They should be able to hold that together. Don't let me pull them apart, okay? That's normal. That is a test of the median nerve, okay? That will screen through most of your potential nerve entrapments right there, which are very common, okay? Other things is sometimes you will have a neuropathy patient that not only has their feet affected, but their hands. So you would maybe want to run the Toronto clinical scoring system. If they have numbness in their feet and their hands, obviously you can't compare those. So what I usually would do is run my Toronto test at a bony landmark by the elbow, say the radial head, and then I would pick out a thumb or a middle finger, and I would do those 5 tests that I've demonstrated in the neuropathy part of our examination training, okay? Finally, palpate relevant anatomy. If you have a carpal tunnel case, we've already talked about palpating here. You obviously want to palpate the pronator teres. If there's potential radial nerve involvement, you'd want to palpate through the supinator and the other extensor muscles. If they have ulnar nerve involvement, you'd want to palpate the flexor carpi ulnaris, the cubital tunnel, and up in the arcade of Struthers, about 8 centimeters proximal to the tunnel of the cubital tunnel. Some cases, if there's trauma involved or you're concerned with arthritis or instability in the wrist, tears of the triangular fibrocartilage, things like that, important to take wrist or hand x-rays, goes without saying. And if you're doing niche work like carpal tunnel case, I encourage you to track your results. So do an upper extremity index at the beginning of treatment and at the end. You do that type of exam, docs, that's a world-class wrist hand exam. Thank you.